Thanks for visiting my channel. You've clicked on this because you've seen the name Naproxen, the brand Aleve. You're right. This is an over-the-counter medication, quite alright, but you need to find out if you can use it, anybody around you can use it or not. And if you are using it indiscriminately, what are you trying to do to your system? All the facts are right here. Without further ado, let's go. Before delving deeper, let's quickly branch and look at some facts here. Number one, it's not good for anyone greater than 65 years, just as it is not good for anyone less than 18. It has analgesic, antipyretic, and anti-inflammatory effect. Pretty easy to use. It is over the counter, right? But must be selected with certain basic pieces of info, which you will get here. It was initially a prescription-only medication. Do you believe that? 20 years after it was made to be prescription only, it was changed to over the counter, and up to date, it is still over the counter medication. This medication is good for symptomatic treatment, and that is the only thing we can use it for. It cannot change the cause of the disease, and the sequelae that may follow a particular disease, like distortion of joints or anything like that, may not change even with the use of this medication. We have to exercise caution when we are dealing with elderly. Remember, anyone greater than 65 years old or less than 18, no. In renal impairment, extreme careful. Cardiovascular system, be cautious. In liver, watch it. In bleeding problems, we'll get all the facts here. Disease modifying anti-rheumatic drugs will handle inflammation better. We are still on preliminary notes. Please use lowest effective dose for the shortest period of time possible. Please. Why that? In a bit. It inhibits cyclooxygenase 1 and 2 isoenzymes, and that will affect prostaglandin production that will be decreased. It will inhibit chemotaxis and alter lymphocyte activity. It also inhibits neutrophil aggregation or activation and inhibits platelet aggregation, but we cannot use it as antiplatelet agent. It could be under different brand names. Aleve and the rest has this. You can pause to get the list or the one that's available in your country or jurisdiction. Belongs to the class of medication known as non-steroidal anti-inflammatory drugs, analgesic, and is non-opioid analgesic. It is a cyclooxygenase 1 and 2 non-selective inhibitor. Forms could be in form of suppository for rectal use, can get generic at this strength. Can be capsule of naproxen sodium for per use, can get this brand or generic at this strength, or suspension for per use, this brand or generic at this strength. Tablet for per use, this brand and generic at this strength. Tablet for per use as sodium, this brand and strength. Also, tablet delay release for per oral or tablet extended release 24 hours for per oral sodium. Now, you can check out. You can pause and check. Naproxen Comfort Pack Cute with naproxen tablet, Duraflex Comfort Gel. Administration. You can take it with food and milk. Why that? We are trying to protect the lining of the gastrointestinal tract. And to protect it further, you can use antacids, proton pump inhibitors, prostaglandin analog, cholestyramine or sucralfate. And it is better to use it 2 hours before you use naproxen or 2 hours after. But I would prefer use it before. When you are taking the tablet, take it whole, and suspension should be thoroughly shaken before use. Delay or extended release must be swallowed whole. And note, the extended release formulation is not good for initial phase of the pain treatment. Still on administration, in case of anyone with bariatric surgery, it would be better to select celecoxib, not naproxen, because celecoxib will not affect the gastrointestinal tract lining, will not cause peptic ulcer disease. So celecoxib will be better here. With that, I will explain further about this because it's going to affect only cyclooxygenase 2. If you must use naproxen here in bariatric surgery, then use immediate release tablet forms, not extended release ones. No gel, caplet, oral suspension. And better still, you might use suppository. And when you use suppository, it should be inserted into the rectum. Mechanism of action. Membrane phospholipid bilayer will be acted upon by phospholipase 2 and will get arachidonic acid. The arachidonic acid will be acted upon by 5-lipoxygenase, giving us the cotrans, or cyclooxygenase 1 and 2 enzymes, giving us prostaglandin and tryptophan A2. The cyclooxygenase 1 will be found in most tissues and joints for prostaglandin production when stimulated for effective renal, gastrointestinal mucosa, clotting, and so on, their functions. While cyclooxygenase 2, that is the one that celecoxib will work with, right? Will be found in kidney, bones, brain, reproductive organs, and certain tumors like the prostatic carcinoma or colon cancer. That is why celecoxib will be good in any gastrointestinal tract protection, because it is not, what cyclooxygenase 2 is not found in gastrointestinal tract. So it's not going to give you peptic ulcer disease. So if you want to handle inflammatory process and you are running away from ulcerative effect on the gastrointestinal tract, go for any of those NSAIDs that will act on cyclooxygenase 2 selectively. So, still part of mechanism of action is that we will have less production of these prostaglandins and tryptophan A2. Now, the summary of mechanism of action. Naproxen will reversibly inhibit cyclooxygenase 1 and 2, thereby decreasing the prostaglandin precursors. It will elicit antipyretics, analgesics, and anti-inflammatory effects. It affects chemotaxis by inhibiting neutrophil aggregation and activation. It has antiplatelet capability, that is as if you are given a low-dose aspirin, by inhibiting cyclooxygenase 1 in platelets, but we don't use it for that purpose. Prostaglandins are needed for renal blood flow, sodium and water absorption in kidneys, account of which we may run into acute kidney injury when we have a medication that will reduce the production of the prostaglandins. It has pro-inflammatory cytokines that will be decreased. Drug-drug interaction. Food can interact with it, but it's better to protect the gastrointestinal lining, the mucosa. Thrombolytic agents, anticoagulant, and antiplatelets will enhance its effects, making naproxen to cause more bleeding. But For further reactions with this medication like selective serotonin reuptake inhibitors, corticosteroids, and the like, please contact your pharmacist or your clinical pharmacologist. The list will be pretty long. Uses is an anti-inflammatory agent like the name implies, non-steroidal anti-inflammatory drug. So it's not a steroid and it's not an opioid. So it can handle pain, that is mild to moderate pain, migraine, gout, dysmenorrhea, ankylosing spondylitis, fever, and juvenile idiopathic arthritis. Monitoring. We cannot just be taking this medication without knowing exactly what's going on in the system. We should have complete blood count done to rule out anemia. Remember, it can lead to ulceration and bleeding, right? In pregnancy, we don't even take this. In fact, any woman of childbearing age attempting to be pregnant should have beta-hydroxychloroquine gonadotropin acid to rule out pregnancy. In cardiovascular system, we have to monitor the heart rate, the blood pressure, and even signs and symptoms of heart attack. In gastrointestinal tract, we have to rule out ulceration, peptic ulcer disease, or gastroesophageal reflux disease. Liver function test to know what's happening to the liver. Renal function test to know what is happening to the kidney. This is pretty important. The rest are also important, but I will lay more emphasis on this in a bit. In ophthalmology, it can lead to blurred vision, so ophthalmoscopy should be done. Clotting profile should be assayed because we don't want bleeding, and we want to be sure that this is not leading to bleeding already, or there are other evidences of bleeding like purpura, ecchymosis, and so on. Side effects. As far as immunology is concerned, naproxen can treat anyone to hypersensitivity reaction, and it might be severe, giving us anaphylaxis. Here we can just have rashes, urticaria, and so on, even angioedema, and it can be worse that we run into anaphylaxis. Some can have drug reaction with eosinophilia and systemic symptoms. Still on side effects, cardiovascular system may suffer. Some will have new onset of hypertension, while others with hypertension before the onset of its use can get the same to become worsened. Ischemic heart disease can, come up, including myocardial infarction, that is heart attack, and heart failure could be on the increase. Gastrointestinal tract could suffer ulceration, bleeding, then it becomes inflamed and could be perforated. And then the individual will be, become one of the patients for surgical abdomen. We can run into hypovolemic shock with massive bleeding internally that is concealed. And if care is not taken, with intestinal perforation and massive bleeding, I might be dead. Still on hematology, there may be hemorrhage, and that will be worse with synergistic effect when there is thrombolytic agent, antiplatelet, or anticoagulant. This is why I'm making this presentation. This is an over-the-counter medication, right? But you are on anticoagulant or antiplatelet for other reasons, and you think because you are free to just grab it, you grab it. You are likely going to teach yourself into bleeding mode, and you'll be bleeding profusely. Prolonged bleeding time is possible with naproxen, and also drug-induced hemolytic anemia, aplastic anemia, neutropenia. In fact, agranulocytosis or thrombocytopenia are all possible while on this medication for a long time. Liver will suffer with increased liver enzymes and acute hepatitis. Renal system, interstitial nephritis is possible. Nephrotic syndrome could be another issue. Papillary necrosis is possible here. There might be hematuria an acute kidney injury. You can see it is over the counter, right? You can easily grab it, but see what you can do to yourself. The central nervous system will not be spared. There may be dizziness, headache, fatigue, depression, or vertigo. The skin can show us purpura, ecchymosis, signs of bleeding, right? Then signs of allergy or hypersensitivity like Stevens-Johnson syndrome, toxic epidermal necrolysis, or erythema multiforme. Other side effects will include aesthetic meningitis, nausea, vomiting, tinnitus, blood vision, worsening of inflammatory bowel disease, that is ulcerative colitis or Crohn's disease. So if you've been diagnosed with Crohn's and you just grab naproxen on your own indiscriminately, then you can get into acute attack again. There might be pruritus, diaphoresis, increased glucose. I put question marks here because I'm not sure the mechanism by which that will happen. And you may run into insomnia. Contraindications. Yes, pretty good. This is where I want everyone to pay attention the most. Because it's over the counter doesn't mean you can grab it and just run away with it and take it indiscriminately. No. There might be hypersensitivity reaction, and when the history of that is in you, you are not expected to use it again. Like I've said earlier, instead can tilt to Stevens-Johnson syndrome. As a matter of fact, I have seen it. I've seen it during my internship. Someone took ibuprofen and died. So hypersensitivity, once that had been part of the history, you don't use it again. Also, note this. Like I said, somebody took ibuprofen and died. Such an individual should not take naproxen because there is cross sensitivity with any of the non-steroidal anti-inflammatory drugs. So the fact that you've not been reacting to naproxen, but you've reacted to ibuprofen or piroxicam and the rest in the group, or even aspirin, doesn't mean you can take naproxen today. Once you have reacted to any of the non-steroidal anti-inflammatory drugs, please don't take naproxen today. In asthma, yes. I've seen a case of a lady who came around and said, Doc, the blue inhaler is no longer working, and the reason then was simply that she was just given the prescription of aspirin. But the aspirin, as wasn't the condition for this asthmatic lady, because aspirin seems to be induced by non-steroidal anti-inflammatory drug or aspirin. Then coronary artery bypass graft. Either you are going into it, you are having it right now, or you are just out of it, don't take naproxen. So asthmatic patient, I would not even ask whether you are sensitive to NSAIDs or not. I will encourage you not to take it indiscriminately. Still, other contraindications, failed organs, certain organs like failure of the renal system to work effectively means you won't use it today. If the liver is failing, no. If the heart is failing, no. When there is high level of potassium, no. Peptic ulcer disease, don't take it. Bleeding disorders, no. And it's not expected to be taken in pregnancy, but when it is even late pregnancy, like third trimester, don't take it at all. Why that? It may close the ductal arteriosus prematurely. Okay, let me explain further here. As a matter of fact, when a child is delivered with patent ductus arteriosus, we use non-steroidal anti-inflammatory drugs, example indomethacin, to treat the condition. The reason is when we need prostaglandin to help in keeping the ductus arteriosus alive, and you reduce the prostaglandin production with naproxen, the ductus arteriosus will close prematurely. If someone is on sodium restriction, then don't use naproxen sodium. Pretty straightforward, right? You're adding to it. So you can see you can not do more harm to yourself than good. When creatinine clearance is less than 30 ml per minute, don't use naproxen. In bleeding or coagulopathy, no. In recent myocardial infarction, no. And I repeat, in anyone greater than 65 or less than 18, no. Now warnings. A woman of childbearing age, take note. Whether she's pregnant or planning to be, or currently taking treatment for infertility, no naproxen. Also, prostaglandins E2 and F2 will be needed for uterine contraction. But remember, with the ingestion of naproxen, you are blocking the production of the prostaglandins. Hence, in labor, these naproxen can unnecessarily prolong the delivery process. I mean the delivery process meant to be spontaneous versus delivery. So naproxen will reduce the level of prostaglandin E and F and would delay the contraction. The contraction will be weak, and then you'll be augmenting the labor. For breastfeeding mothers, I would say no. Still on warning, and pregnancy, and in the early part of that pregnancy, no. Because inhibition of cyclooxygenase 2 can cause miscarriage. And if you escape that and the pregnancy is sustained, you might have oligohydramnios. With oligohydramnios comes pulmonary hypoplasia, limb contractures, some birth defects like ductus arteriosus closing prenatally. Some can have persistent pulmonary hypertension. Renal failure is possible and even intracranial bleeding. Some say, well, we can still use it on 24 to 28 weeks. Really? I'm not comfortable with that. In third trimester, no, please. If by accident you are taking this or you ingested it during pregnancy, it should be the lowest dose for the shortest period of time, and please assay the amniotic fluid level. Why that? Oligohydramnios will give us so many problems, so just do ultrasound to find out the level of the amniotic fluid to rule out oligohydramnios. Still on warnings, thrombosis and thrombotic events may ensue. The central nervous system may suffer with stroke. Cardiovascular system, I've talked about heart failure, ischemic heart disease, coronary artery bypass graft. Just exclude anyone with heart disease generally, please. Gastrointestinal system, bleeding tendency with naproxen will increase in the face of concomitant use with other anticoagulant, antiplatelet, thrombolytic agents, selective serotonin reuptake inhibitors, someone with liver damage, or someone taking corticosteroids. So if you are taking any of these with naproxen, expect gastric ulceration and bleeding, including gastroesophageal reflux disease that may lead to inflammation and perforation, and if care is not taken, death. In pediatric age group, it may give us pseudoporphyria. Now, renal failure, please don't use if creatinine clearance is less than or exactly 30 ml per minute. Still on warnings, and finally, back to reproductive system again, and precisely in women. You can become infertile. Why that? by preventing the rupture of the ovarian follicles. Yes, it is over the counter. Yes, you can take it. Yes, the body is your body. Yes, you can take your decision as you like. You are absolutely right. But if you're a woman of childbearing age and you are working to become pregnant and you are taking naproxen all the time indiscriminately high dose, you might be the cause of your own problem by having the ripen or ready to rupture ovarian follicles not rupturing. It can prevent the rupture of that ovarian follicle. And there's nothing for your guy to fertilize. But one good luck here is that this is reversible. Once you've listened to this presentation and you stop, not long, I don't know when, once your ovary is still functioning well and other factors are in place with your spouse, you might become pregnant. You're already pregnant? Why taking naproxen? Please don't. Why that? For the third time, I'm going to repeat. It can close that ductus arteriosus prematurely. And I've said, and I'm going to repeat again, in patent ductus arteriosus, we use non-steroidal anti-inflammatory drugs to stop the work of the prostaglandin and close it for us. Now we are using that instead indiscriminately. It will stop the presence of prostaglandin and close the ductus arteriosus before its time. In breastfeeding, I would say be discouraged. Don't take it. In conclusion, this is a good medication, but it will become a bad one when we use it indiscriminately. So, discuss with your physician, clinical pharmacologist, or pharmacist. With that, I come to the end of this presentation. Naproxen is a good medication, specifically a non-steroidal anti-inflammatory drug. Now, we've known you can be doing yourself more harm than good, depending on how you use it. Thanks for listening. Please share this with everyone. I appreciate it.